Introduction and role in theoretical foundation of psychotherapy across the lifespan. So, of course, let's start out with effective counseling. This whole course is focused on counseling and counseling theory and approaches. So the most important instrument you have in counseling is you, yourself. Be authentic and don't hide behind your role. Be a therapeutic person. So research on psychotherapeutic outcomes really talk about the key factors of the relationship between the therapist and the person overall. Contextual factors, not techniques, are the primary determination of therapeutic outcomes overall. So let's begin by discussing counseling for the counselor. You need to really understand countertransference and other issues that are triggered by clinical work. Explore your motivation for being in this type of work. It is important for counselors to also remember their needs. You need to be committed personally to your own values and morals and really examine them if you plan on helping somebody else. So as we talk about you as the counselor or therapist, we're going to talk about avoid, invest, and assist. So avoid value imposition, either direct or indirect. Invest time to explore your personal values and recognize that you are not value neutral. Assist clients in creating goals and finding answers that are most congruent with their own values. I stress their own values. So now let's talk about managing value conflict. Bracketing can be used to help manage value conflicts. Counselors should not refuse to render services to clients because of differing values. Seek supervision or talk with colleagues or peers if you're struggling. Become multicultural competent. Become aware of your own bias, values, cultural norms, and expectations. Attempt to understand the world from your client's vantage point, which is extremely important. Gaining knowledge of the dynamics of oppression, racism, discrimination, and stereotyping. Study the historical background, traditions, values of clients. Open to learning about him or her. Expand your vantage point to explore your client's way of life that differs from your own. Develop an awareness of acceleration strategies. Really knowing yourself and understanding yourself is key. So, of course, we need to talk about some of the issues faced, especially when you first start out seeing clients. Understanding silence and the use of silence. And many of you have already experienced some of these therapeutic techniques in undergraduate nursing. Dealing with demands from clients. I always talk about setting the line, setting the bar, and understanding what you're maintaining that bar with a client. Clear communication of where your values sit, trying to understand your client and where your client is coming from, but don't put yourself in a situation. So dealing with demanding clients is very, very important. Dealing with clients who lack commitment. They're not showing up. Where do you stand with that? Tolerating. Dealing with Anxieties, being oneself and self-disclosing. What do we self-disclose? Avoiding perfectionism. Being honest about limitations. Can you service this client therapeutically or not? You really need to define your role overall, both as a therapist, counselor, as well as the person that might be providing with some medication. Learning to use techniques appropriately as we study each and every technique, and being able to change your technique or refer them to somebody that might be able to meet their needs. Develop one's own counseling style. What is your style? Avoiding losing oneself in one's client. The attachment, the transference, the countertransference, the empathy versus sympathy. Developing sense of humor. Sharing responsibility with the client and declining to give advice. Giving advice can be very dangerous. Many clients will come in feeling that that's why they're there. So let's go back to self-care. I often tell my students that they should also seek counseling while they're in school and possibly even after school. It is very important to take care of yourself. You are the most important instrument to your clients. Develop self-care strategies. Checks and balances are very important. Know what causes burnout. Know how to recognize and remediate burnout. You're go, 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 trying to get involved, trying to help clients. What causes burnout? Know how to prevent burnout through self-care and checks and balances related to self-care.